it's my pleasure and privilege to wind up this hematology session of the day. And, I'd like to say that if you have Sandeep Jasuja organizing a meeting, getting the sponsor, then you have Dinesh Purani doing the scientific program, you already have the genotype of a great meeting. And that's what we had. We had a great meeting, very high quality science. Started with our own Dr. Aditi Mittal. She told us about invasive fungal infections in hematology, oncology, and the new drug posaconazole, both as a prophylaxis and as treatment. Dr. Lalit Mohan Sharma, my very dear friend, talked about the TPO agents in chemotherapy-induced neutropenia. And then again, all of us are using these agents and we find them useful, but they are still yet to make it into the guidelines. We had a fantastic lymphoma discussion moderated by Dr. Hari Menon, one patient of early stage but large lymph node mass, and another patient with double hit lymphomas, and some very clear-cut messages and some excellent inputs from Dr. Ranjana Advani from Stanford. I'd like to particularly thank our international faculty, Dr. Ranjana Advani, Dr. Shaji Kumar, and Swami Iyer. It's a very early morning, very early Sunday morning for them. So we really truly appreciate their presence and their inputs. We had a wonderful talk by Rahul as usual, lots of slides, lots of material condensed into a short period of time, and the role of the JAK2 inhibitors in myelofibrosis. Then we had a incredible talk by Dr. Shaji Kumar as always on personalizing treatment for myeloma. Like if you have a patient with 14 translocation versus a patient with deletion 17, you have to approach them differently. Even though you have so many drugs, you can still fine-tune treatment to suit a particular patient's need. We had a great panel discussion by Dr. Pankaj Malhotra. What do you do in a patient who relapses post-autologous transplant, who has a small MVAD, who has an extramedullary plasmacytoma, and extremely valuable inputs from Dr. Advani from his vast experience. Dr. Suresh Babu gave us a very nice insight upon the second generation BTKI inhibitors. The acylabrutinib, it is now available to us, the various advantages and the pivotal study. Then we had, as usual, fantastic talk by Dr. Mohan Agarwal on the role of second and third generation TKIs and why possibly nilotinib is close to an ideal agent for the newly diagnosed patient of CML-CP, particularly if you have a young patient and TFR is the target. And then we had an incredible talk by Dr. Swami Iyer on all the aspects of CAR T cells, the allogenic CAR T cells, the off-the-shelf CAR T cells, the toxicities, the reasons for the toxicity. So all in all, we had a really, really good hematology session covering quite a large area of hematology. And again, as to be expected, if Dinesh Burani is teaching the scientific program, it has to be excellent. So, ladies and gentlemen, thank you very much. My privilege to wind up this session. And those of you who want to do activities on Sunday, particularly watch the French Open. Go quickly. We are into the third set, and Nadal is killing. Djokovic has already won 2 sets. Maybe he's already won the match by now. Thank you very much. Over to you, Dinesh.
With this, I thank Dr. Malhotra and especially thank Dr. Jasuja. He takes a lot of effort. I think everyone should thank for this scientific feast to Dr. Jasuja because he takes a lot of efforts into the organizing and keeping everyone engaged. So kudos to Dr. Jasuja. Thank you to Dr. Swami Iyer, meeting him again. And thank you to all you guys sitting on Sunday night, escaping IPL and French Open. So thank you all. Dr. Jasuja, want to say some word?
Yeah, thank you very much, sir, for conducting these nice sessions and organizing with us as a program director. Really, I am very grateful to you and my national faculty and international faculty. They did a very great job, and really, especially thanks to Dr. Advani sir, Advani madam, and Iyer sir and Shaji Kumar sir, Pankaj sir, because for them this is early morning, and early morning they are just preparing themselves from getting out of bed and everything, and managing is a little bit even tough for us also. So really very thank to them, my international faculty, all my 3 days international faculties of our 3 days conference, and with this And I also will try to continue our this conference, like this is the fourth session. Now we will try to continue this in the fifth also, and hope for best we will get a more good quality discussion and academic feast in next our conference. And with this, thank you very much, and have a very good night.
Thank you.
Thanks.
Thank you.